Jackie Bennett. Pronouns are she and her. Welcome to day 2 of ASA's Generations Forum on Advancing Equity in Aging. And happy non-binary awareness week to everyone as well. I'd like to take a moment to honor Sharon Brackett. She was a tireless gender rights advocate in the state of Maryland who passed away just over a month ago. Sharon helped Leanne early on plan today's event and had offered to speak about her work to help medical students and doctors understand trans issues. Today and always, we honor Sharon's life and memory. Today we're talking about supporting trans and gender non-conforming elders that we might work with, who we might also be in the workplace, families, and neighborhoods. LGBTQ people face health disparities due to stigma, discrimination, and violence, and these things increase dramatically in the trans community. Trans and gender non-conforming voices are vastly underrepresented in surveys and in research. But surveys by scholars like Karen Frederick Goldson reveal some disparities. 40% of trans older adults reported being denied health care or given poor health care because of their sexual or gender identities. Nearly half are from low-income households, and on average report 11 incidents of discrimination and victimization, which is nearly twice as high as non-gender LGBT or LGB older adults. For transgender people of color, access to healthcare and economic opportunities is even more precarious due to racism and systematic discrimination. Addressing these disparities takes work from all of us at a societal, community, and individual level. We have 3 experts with us today to talk about the work they're doing and have a conversation about how we can be more inclusive and supportive in our work as well. This will be a conversational hour, no formal presentations, so please type your questions into the chat and we'll get to as many of them as we can during the course of our hour. So Cecilia, let's start with you. Pronouns are she and her. You're a founder and principal consultant at the Trans Equity Consulting and have worked in a number of community organizations over the past decade. Briefly tell us about your work at Trans Equity Consulting.
Yes, first of all, thank you for having me here. I'm so excited to be here with Dan and Jude and with you. Thank you for facilitating this space. Yeah, my name is Cecilia Gentili and I have a consulting company and I do consultations and I have a team of, we are about 10 at this point and we are all trans people. Not because we discriminate these people, I just happen to find brilliant trans people to work with me. And we are 10 of us and we do different kind of work around consulting with government, nonprofits, and corporations. And the final goal is to create some sense of gender equity that has a very specific input around trans people. And usually when we think about gender equity, it is always an input on an idea of creating equity centering cisgender women mostly, and we think that gender equity could have an approach that is much bigger than that because gender is much bigger than just cis woman. So that's what we do in different ways, you know, HR consultations, events, trainings, and anything that organizations may need. So that's what we do.
Thank you, Cecilia, and welcome. Thank you so much for spending time with us today. Jude, pronouns he and him. You're a mental health practitioner, author, editor of a book series called Trans Accessors, and you're a trans activist. What are you working right now that most excites you about the work?
Currently, I'm privileged to have recently been chosen by USPATH, the United States Professional Association for Transgender Health, to chair a brand new committee that I have been advocating for a number of years, a lot of years. And they created a subcommittee about trans aging and end-of-life care. And I'm fortunate enough to have already at least a dozen people who have a great interest in that join the committee. We plan to do some work around, hopefully expand this worldwide as a subject for the professional people to think about. It is long overdue, and we hope to develop the new standards of care that address these issues. That's the big thing, okay? And I continue to work on my book series, which is very important to give voice to other folks like me.
Excellent, Jude. Thank you so much. And finally, Dan, pronouns are he and him. You're a gerontologist, and you're joining us from the Human Rights Campaign today, where you are the Associate Director of the Aging Equality Project. What is HRC doing in the trans and non-binary space right now that you're most excited about?
Thanks, Jackie. And again, thanks to ASA for having me, and to my wonderful panelists. Really excited about our conversation. At HRC Foundation, we really believed in creating a world where LGBTQ people can fully participate in the systems that shape our daily life. The systems in which we live, work, pray, and grow older in. And what we know is that with lack of protections across the US for a lot of LGBTQ folks, there is a need. And so our latest initiative that I'm very proud of to oversee is the Long-Term Care Equality Index. The Long-Term Care Equality Index focuses and is centered around creating a more inclusive environment within long-term care communities, specifically within education, but policy and practice. HRC Foundation, where our focus lies, is often within that practice policy initiative in order to help change long-term systems. And what we see and what we'll talk about today is as we care for trans and non-binary folks throughout the aging process, as a future trans older adult myself, I know and see that there is fear. And with this initiative, and happy to talk about the other work, we're able to focus on that and truly reach people when they're at the point of vulnerability and just need to rely on their care and focus on care versus fear and concern.
Very good. Thank you, Dan. Thank you very much. Cecilia, let's start with a set of questions for you, first of all. Tell us what elderhood means in the trans community and what it might mean to you.
Well, I am 49 years old, and I grew up in the 80s and 90s in Argentina, and not only in Argentina, but in general in the world. I think it is a huge effort to overvalue youth, not just by overvaluing youth, but by undermining aging, right? So I always had a difficult relationship with aging and with me as a person who ages as a trans person, right? Being young as a trans woman who was a sex worker meant, more money, meant more safety, meant, being able to navigate the world in a specific place. So I always had a very specific relationship and a little bit of a phobia issues around my own process of aging. And it has been a process, and I came to understand that, that I am okay with aging. And one time somebody asked me to do an interview for a magazine, and I did the interview and I didn't know what the name of the interview was. And when the interview came out, it says transgender elders share their experiences. And I was like, I didn't know that I was an elder. But then I started thinking, if we think that the life expectancy of a trans woman of color is between 32 to 35 years old, I'm 49, I'm an elder, and yay, I celebrate that I made it to 49, I celebrate that I'm gonna be 50 next year, and I celebrate that I'm able to, to continue with my life, not only with the life, but also with an opportunity to thrive as a person who should have the same opportunities than everybody else. So for me, being an elder sometimes doesn't have much to do with actual age. It has to do with experiences. I know people who are 18 years old in the trans community, and they are functioning as parents, of a 17 years old. But, it's just one age difference. But, families of choice bring opportunities to have roles that sometimes are associated with age in a different way when you are trans. So for that, I think like the idea of being an elder, I celebrate, me at 49, I celebrate other elders at 80 and 90, but I also celebrate younger people who are acting as elders in the community because they have to, because they are only people who can be looked at as elders by others.
Very good. Yeah, absolutely. And I would invite our audience to put into the chat what elderhood in the trans community means to you. So now, Jude, I'll throw the question to you. What does elderhood mean in the trans community, and what does it mean to you?
Well, I just turned 81 years old. Cecilia was talking about 80 and 90-year-old. So I'm happy to be alive and still active, and have had actually a very wonderful life, considering everything that most of us have gone through to get to an elder age, especially trans people. It gives me great joy in the work that I do, and I agree that we need more dialogue between youth and elders. It's essential for them and for us to build relationships together. I laugh at myself. I have been open, out, and proud. I transitioned actually started my transition on hormones in 1970. So I have lived and worked and breathed and so on and so forth throughout the following years. And my big joke is that though I am open and out, nobody asked. They stopped asking a long time ago. So people think about me as just some old guy down the street. And I have to laugh and say, well, I am just some old guy down the street, but how I got to be that some old guy is very different, and how that shaped me as a human being to be transgender and be that some old guy is I'm grateful for. I got to choose what kind of man, if you will, that I want to reflect, the kind of person I want to reflect as being seen as a male person in our society. And I have always been a feminist in that sense. And those earlier relationships I had were with radical lesbian feminists who really had a hard time with me going through transition, and many still do today. That's reflected in a story of a friend of mine who had been a nun, and when she left, the order she belonged to required wearing a habit, and when she left being a nun and became a civilian, if you will, the same streets that she walked down became very different. Before, she said she could walk along and meet people, and they would say, "Hello, sister. How are you, sister?" And she could pat their children on the head, and everyone was very happy to see her. As a civilian with no uniform to identify her place in the world, she could walk down the same street and no one said a word to her. And if she tried to pat a kid on the head, she'd be looked at, as she was some kind of a nut. And she explained to people that we were in a group together that that's what my world was like too. That I had always walked down the street with other people identifying me wrongly as being female, and now that I was male, my whole past was invisible. And I think what I feel best about is, while that may remain invisible, it shaped the person I am. And what I've done, and the people I've been interviewing, and the authors who are submitting stories from my book series, the resilience is amazing. The contributions are amazing. It's just, I even more than I thought there would be.
Yeah, and indeed. And so, Dan, that leads me to my next question about, what are some of the struggles and needs that you hear about in your work with the trans and gender nonconforming community there in HRC?
Most definitely. I think Cecilia and Jude bring up these key components in which, as trans people, the world is not built for us. And when we talk about what are the struggles, it's living in a world that has not prepared for the needs of us. And so when we add in the intersection of aging, when we add in the intersection of decades of discrimination, where do people's voice go but to become quiet, out of safety, out of fear? And so when we recognize the needs of trans and non-binary folks, it really looks at who are providing services, who are the spaces, who's the owners of the spaces in which folks interact, and is there an awareness of what those needs are? Trans folks face the highest rates of being unhoused, dealing with chronic illness and disease. And I think while we share these facts, as we share what we know in the research, as you mentioned with Fredrickson Goldson and the Aging with Pride study, is that a key component of what we're doing here is really seeing the humanity of us and experience, as Jude said, just down the street, but how the experience of how we got here is so critical. And I think for one thing, in terms of how can we change this, it really is changing the narrative of not just acceptance, but celebration of trans and non-binary people. That we are elders in your own right, Cecilia, as you said, and the fact that we have elders in our community that are 18, 20, 30 years old, because trans folks aren't expected to be old. And so where that lies, I believe, is a lot of invisibility, and in turn concerns and lack of inclusive care.
Yeah, so much that's true. As a gerontologist, Dan, what do you see as some of the most glaring occurrences of transphobia?
I believe, and we believe at HRC Foundation and in partnership with SAGE, that most providers want to provide informed care, but where we see experiences of blatant transphobia is often in healthcare, often in housing. When we think about the barriers that exist within housing, a lot of times we're looking at folks that may have documents that don't match, that, when I applied for a home and they looked at my credit record, they saw my old name prior to transitioning. And so there are all these elements in place in which organizations, unfortunately, there may be individuals who straight up say, like, no, we're not going to accept a trans person because of the concern around policy, because of the concern around procedure, in which ultimately what folks are seeing then is liability, the frustration, the work, rather than the person. And so I think in addition to these big ideas of long-term care communities denying access, hospice agencies denying access, a key component I think is also taking consideration microaggressions and these often compliments that I like to call them, and these assumptions of what we think trans people should be, should look like, what they should do in order to be their true selves. And some things to just share in terms of compliments, the idea of, someone were to come to me and say, I would have never guessed that you were a woman, or, making the assumption that if you're a, non-binary, feminine presenting person, that you shouldn't shave. So we have a lot to move forward from, just from, our ignorance being a contributor to that transphobia that we see, and the ignorance that can cause harm.
Yeah, so true, so true. Cecilia, the next question is for you, and then I'd like to hear from both Dan and Jude on this as well. Speaking of like service providers, and we take the healthcare area, as Dan had mentioned, what do you want every doctor and nurse to know about elder, trans, and non-binary clients?
Well, first of all, that we exist, right? And that we have bodies like everybody else, right? I have a body that, yes, have very specific parts that look a certain way, but they're just body parts. And you're not going to be a stranger to any of those body parts. Look, the only thing that you have to do is treat it with respect, right? And treat my body with the same respect that you would treat any other body, right? So respect doesn't change from cis to trans. It's respect, right? So if you respect a body, you know, as it is, right, and you treat that body with care, and you treat that person that lives in that body with care, you know, you can create an enormous amount of wellness for this person, right? I'm gonna also take a little bit of the pressure from doctors and nurses, because I actually have never met, I have met medical providers who were blatantly, you know, transphobic, but I have met a whole bunch of medical providers that they were not transphobic. They just didn't have the tools, right? Sometimes it's not the nurse, it's not the triage nurse that makes a decision to be transphobic. Most likely that nurse didn't have any education around trans issues in school. So it's not her, it's the education system that doesn't include, you know, trans materials in their development of these professionals, right? Sometimes it's not this triage nurse that is transphobic, it's the fact that she comes and see an intake form that does not provide an opportunity for me to describe myself, my body, my experience, right? Sometimes it's not the triage nurse that is transphobic. Sometimes the triage nurse is extremely overworked and underpaid, right? So I wanna say that yes, it is medical providers who may be transphobic, but it's also a whole bunch of medical providers that just didn't have or don't have the tools to provide services that are comprehensive and sensitive to trans people. Doesn't matter if I'm in pain, you know, and I am in a hospital, I get annoyed, right? But you know, we all have an opportunity to do better for trans people in medical services. And as I said, like, you know, if I have the flu, it's just the flu. It's not such a thing as trans flu or cis flu. It's the freaking flu. It's the same one, right? No need to make a difference. So let's think about a person as a body. And if it comes to the fact that whatever issue or whatever health issue that they're having has to do with their transness, has to do with their hormone replacement therapy, has to do with a history of abuse because of their trans, then let's make it trans. But not everything is about my transness. A lot of me is just me having a body that is getting older and needs care, right? And sometimes it has to do with me being trans, right? So let's make sure that we offer both things, like overall care and specific care as needed. And another thing that is very important, I have a lot of sex. And most of the people that I know that could fall under the elders category have a lot of sex. Let's not forget about elders, trans elders having all kinds of sex, right? Let's not dictate the kind of sex or the amount of sex that people of a certain age can have because they are trans. So sexual health for trans people is very, very important. So all of that, just that.
Thank you, Cecilia. That's very good. Judy, what about you? Anything about, you know, what would you want every doctor or nurse to know about trans and non-binary clients?
Well, what I would hope for is that there's more information on a statewide basis for different organizations and nursing homes to be required to have a certain amount of training, which they're often not, just as others are often not, other medical care personnel are not. California, I'm lucky to live in California. They do have a couple of bills that do talk about end of life and nursing home, and even things like, the coroner and putting the right sex on your birth certificate, so on and so forth, your identity. But at an individual level, I often think if I have to go to a nursing home, I am out, open, proud. I have been advocating for myself for years. I can do that work if I can still talk and understand what people are asking. But I work with clients in my private practice who do not have that capacity, do not know how to advocate for themselves in any way at all about their health care, let alone the trans part of that. Cecilia, I loved what you said. And so my clients have fears even of starting with a primary care doctor, let alone what's going to happen to me when I get in a nursing home. And so many of the trans elders I talk to say that is not an option. When that time comes, I will end my life. That's scary to me, that the fears are so great. On a personal level, I try to do what I can. I know that locally, I had a friend who was in a nursing home briefly for some rehabilitation work. And I made it my business to go up and down the hallway and look at all the bulletin boards to see if they had posted that notice that they require in California. And sure enough, it was not posted. And so I could go to the manager or whoever's in charge and make the comments that I thought were needed to be. But if it's a law and no one knows about it and no one's doing anything about it, that scares me even more. Another comment that has little to do with the question you asked, but about nursing homes, is that so many are being taken over by religious organizations, or already are owned by religious organizations. And we are still faced with all of the lawsuits about religious freedom and religious rights and being able to deny care. So that for me is a biggie too.
Yeah, for sure. Dan, how about you?
I really appreciate, and really, in terms of Cecilia's and Jude's words, I think encapsulate a lot of experiences from you all and beyond you all. When we see what's happening nationally, it's these experiences of not seeking primary care for folks that are concerned about moving into a care setting that are willing to end their life because of that deep fear. And there is such an opportunity for providers to be able to care, to be able to educate themselves, even if they haven't had that initial education within their medical training, nursing training, social work training, with all these professions called to a higher level of competence and care in terms of how do you show up for your patients. There is such a critical need and lots of resources, and I'm seeing great resources being shared in the chat, that in turn can access care not just for that one patient, but their entire network. Within the trans community, often folks have to rely on word of mouth, community vetted organizations. If the organization doesn't have steps that they've taken to explicitly show their inclusivity, often it is that word of mouth feature, because there is such a desire and a need for someone to treat me as a patient, to see my body regardless of, and the assumptions piece, right? The more that we can provide patient-centered care, the better quality of care, but you have to know the person before you can provide person-centered care. And that includes our sexual orientation, that includes our gender identity. And there are steps that organizations can take to, start that journey in terms of, discrimination policies, in terms of education, as Jude said, as well as in really supporting those legislations that necessitate long-term care communities to recognize and protect and educate around LGBTQ folks and older adults with HIV. So there's, I think there's a resilience and a resilience shown within my my fellow panelists that I think is really, I hope, a motivating factor for providers to want to improve their skills.
Absolutely, absolutely. So let's just follow that thread. We're talking now about caregivers and social workers. Jude, let's start with you. How can our social workers, case managers, other folks who do services like that create a welcoming and supportive environment for trans and non-gender conforming clients?
First of all, I would say at every step of the way, in terms of when you're admitted to a nursing home, who's with you to advocate for you when that happens, if starting ahead of time, speaking about it ahead of time with your family and your friends and all of that, and hoping that you have supportive people working at having supportive people in anticipation of that time. Unfortunately, there are times when you can't anticipate what's going to go on. You didn't anticipate, you thought you'd live forever kind of idea. But when you do have that opportunity, and as I mentioned before, all of us here who are talking about this have a sense of comfort about educating, but perhaps our client or our family member does not. Maybe we don't know enough as a family member. In the setting itself, I would make sure that there were materials available that were posted that you are a welcoming community of caregivers in the facility that you work. I think that's very important. And don't assume that you cannot start trans and LGBTQ specific activities as an activity director, that there's a chance to educate everyone there, that create sessions where that's, you know, that can be available for those who wish to participate. Not a lot is written, and I find it frustrating myself that so much of what is written leaves out the T. In other words, it may be included in the title, but when you dig into the information, there's no T there at all, or very little about that, including transgender aging and end of life sorts of things. And the one important thing we haven't talked about, and this, you know, we're talking about settings and caregivers, but what about end of life preparations? What about after your death? What about people who are not treating you at your true identity, not respecting that, as Cecilia said? What about the fact that the fears I hear from people about being in a nursing home are things like, what if they make me wear the clothing that's not acceptable to me? What if I have not had electrolysis and I need to have my face shaved each day? What if they don't use the right pronouns? Things that seem simple requests. And there's so much to do. I'm so happy that you all have included this in your week-long trainings, and to do much more of that for me is we need to reach out a lot more, and we need to be more T inclusive. And then the HRC stuff that you're doing about nursing home, you know, quality index is amazing work. Okay.
Absolutely, absolutely. Cecilia, how about you? How can our caregivers, our social care providers create a welcoming environment for for transgender clients?
I'm going to go back to paperwork and to intake forms and to like you know, I think it's extremely important to create intake forms that reflect who this person that we are meeting here is, right? It clarifies so much, and it makes the relationship between the provider and the trans person so much easier when we know details that are crafted through questions that are inclusive of people, sex assigned at birth, gender identity, sexual orientation. With that, you can see that, that I was assigned male at birth, that I identify as a woman, and that my sexual orientation is lesbian or pansexual, or whatever my sexual orientation could be, right? And that gives you a lot of understanding what my gender pronouns are, right? Mm-hmm. So I am going to go back to just talk to your organizations, like wherever you work, and say like, hey, these intake forms that we're using are not fully reflective of some of the people that we are serving, and we have an opportunity to change them. So that is one of the most important steps that I always urge people to do, negotiate with the organization where you work on how you can change some of these things. Normalize gender pronoun. Normalize gender pronoun. I hate when I'm asked gender pronoun and I'm the only person who's asked gender pronoun. If you're gonna ask gender pronoun, ask everybody's gender pronoun, right? Because when you ask just me, you basically are telling everybody that I'm trans, right? So, normalize gender pronoun, normalize like restrooms. Restrooms are places where people go to do either one or another thing, right? And if you think in your house, your bathroom at home is gender neutral, right? Anybody can use it, right? So that should be the same thing in everywhere, right? And kind of like people providing services, again, I'm gonna say like, sometimes we have like extreme numbers of cases in our caseloads. It's hard to ask for this. It's hard to ask you all to kind of like try to spend more time kind of like getting into deep into the needs of this person, in this case a trans person, but it is important. I believe that in my case, when I see myself as a client or as a patient, I just don't see my transness. I see a very intersectional person, right? Who is trans, who is a woman, who is an immigrant, who is a sex worker, who is a drug user, who is in recovery, so I am an intersection. I'm not just trans. My transness is a big part of who I am. And my care should be crafted around my transness, but with a very intersectional approach. So taking the time to do a little map of who this person is, what the identities of this person are, and how do they intersect and create this situation, this reality that this person is living, and from there, how we're going to help this person, I think is very, very important.
Very good. Thank you, Cecilia. To our audience, I would just encourage you again, if you've got questions for our panelists, please put it into the chat. Yes,
we do. Sorry please pardon the interruption. We do have a couple questions along the same lines of what we're talking about. And the questions, I'll summarize two of them together. Cecilia, how would someone know that they're going too far and asking too personal of information on an intake form? Or maybe questions, how can providers ask questions that are respectful, but what is that line that goes too far? Help us understand what's too invasive and what's inclusive.
I think as long as you have a perfect explanation of why you're asking what you're asking, the person will be fine, right? I remember I live with psoriasis, right? And I have psoriasis on my elbows, mostly in my knees, right? And I remember I went to a dermatologist who was like extremely into getting to see my genital area. And I was like, I really don't have any psoriasis there. And he was like, well, I have to check. And I was like, I don't think that's really necessary though, So if you don't have a consistent explanation of why you have to see my genitals, maybe you don't have to. Because if you have a consistent, like an important answer to my question, then I go like, oh, I get it. Yes, look at it, right? So if if you are treating my gastritis, right? Doesn't matter who I sleep with. It's just gastritis. But if you tell me like whoever you're having sex with may affect your gastritis because this or this and this, I was like, oh, you're right. Yes, I have sex with men, women, trans people, or whoever I'm having sex at the time, right? So I think that is very, very important to know like that specific line that is like, when is this necessary and when is this curiosity? When is this some kind of like gossipy, is this really necessary, or I'm just trying to learn from this person? Because if you're trying to learn from this person, go to Google. You can learn the same things from Google, right? But if it is about care and you're able to offer an answer to why you asking these questions, you're good. Everybody's going to thank you. Nobody's going to get mad at you. Trust me.
I want to bring something up we haven't talked about yet. One is the generational part of this and being in a nursing home, and how many people from my generation, for instance, who may be still closeted, who may not have been out, who have gone through all of that sort of thing and have more or less decided not to be public for most of their lives or all of their lives. Or they go back to the idea that I did face this kind of discrimination that was awful. I don't want this known. And we're all making assumptions that we're going to all go in there and somehow be comfortable with telling any of that information to anyone. And I don't necessarily know how to handle that, but I think the initial intake paperwork is very, very important. And when you ask questions about any kind of sexuality to any human being, we all have hesitancy sharing that kind of private information. And it may be that a subsequent interview within a short time where one can have more privacy and then perhaps build trust and more trust with a person so that they can give you more information about what their needs are. And the other part of that, Cecilia, you brought that up. I am more than just being a trans man. This has been a life mission for me to help other people in this way. However, I'm a grandfather, I'm a father, I'm a great grandfather, I'm an animal lover. I fight for the environmental rights and human rights and all that kind of stuff. This is my life beyond being just a trans person. And if we start asking questions about that as well in any setting, as we're getting to know people, I think we find out a lot more and we build a lot more trust so that we can ask those more intimate questions.
How about you, Dan? You want to jump in there?
I want to touch on two things just in terms of, Jude spoke about education and Cecilia spoke about intake forms, asking questions. Those really are, critical foundational things and, ways to gather information that gives people an idea. If I see an inclusive intake form, that means one, they know that LGBTQ, but not just that, but the T and non-binary folks exist. Which already sends the message that perhaps this is a space where I can, take a breath a little bit. In terms of what else can be built on that, I firmly believe that for that sustainable change, there needs to be, in addition to that foundation of education, of inclusive policies. Does our non-discrimination policy for our clients, patients explicitly say sexual orientation and gender identity? Does our employment non-discrimination explicitly say sexual orientation and gender identity? Folks in half the states have no protections for sexual orientation and gender identity. So to set the standard of this is our organization, that then you have the opportunity to support not only the clients, support your staff, in a culture change that recognizes people. I just want to highlight that in the chat, I added a link. It's blei.org/guides. This will take you to 3 key guides that were developed by the National Resource on LGBTQ Aging that covers questions. There's a guide on how to ask sexual orientation and gender identity, There's a guide in creating a welcoming space within your aging services. And then there also is a guide that I don't believe is posted on that page that's specifically with how to create area agency plans, specifically with LGBTQ individuals as a part of that plan. So, you know, there's a lot of resources that we can definitely share and share after this as well to manage and talk about some of these more nuanced things of what does it look like. For those that are in long-term care, you know, we talk about policy not just in terms of inclusion, but also are there policies that people have to go by the name, you know, we ask what people's names are and use it, that pronouns, that respect is included. And just to jump on this question from Ari, in terms of generally accepted age range for LGBTQ elders, I'd like to hear from other panelists. I think in just terms of the research, we really start out at that 50 range because of lack of social social inclusion, SOGI, sexual orientation, gender identity information. So we have a bigger sample, but that being said, as LGBTQ people, our aging experience is sometimes more accelerated because of the discrimination, because of the lack of access, that in turn, there is that greater need and recognition of who we are encapsulating, but also, within our communities, elders means a wide variety of things.
Jude, do you want to go ahead?
Yeah, I'm glad you brought that up, Dan. I had to make that decision in my cutoff age for my books too, about who's an elder, what age should I start with, and I landed at 50 as well, for the same reasons that you talk about. The other is, I think we haven't said this, but we're all victims of ageism, no matter what our orientation, our identity is. And I have more difficulty personally dealing with ageism and being invisible because I'm older, not only within the general community, but certainly within my own community. I can't tell you how many times I've been at conferences and have people make a remark, "What's that old guy doing there?" I went to, there's a gender center here in Sacramento area. I won't mention the name of the person who said this, but I was at a meeting a couple of years ago there on the premises as part of a work group. And one of the people came in who's kind of has a position, a higher position in that organization. And as a breaker to talk about, to get people relaxed, they said, "Well, what did you do that was fun last week?" And everybody went around the circle, and it came my turn. I said, "Oh, my partner and I went to see Johnny Mathis in concert." And the response was, "Oh yeah, I heard the wheelchair and cane crowd was there." I thought, you pride yourself on all this stuff about identity and so on and so forth, and yet look at you and what you're saying. So that to me is something I think we all have to think about, that ageism itself within any community is something we have to fight. And particularly in communities, LGBT communities, where youth and beauty seems to be even more a source of, if you don't fit in those categories, you're in trouble.
Yeah, absolutely. Cecilia, any comments about ageism?
I believe that we live in a world where we all can, where ageism doesn't really discriminate between cis and trans people. But when it comes to trans people, ageism comes with a whole bunch of different repercussions, right? When you look at ageism and the trans community in terms of employment, you have two very important oppressive systems that make, trans elders into a whole different level of risk when it comes to employment. So again, when we look at ageism in an intersectional way, the consequences can be much more harder for trans people who are elders in this case.
Yeah. I saw a chat, a question about policies, and what kind of policies would we like to see to support the transgender LGBTQ population in general. And Dan, you touched upon that when you spoke about half the states don't have protections for folks from an employment perspective if they happen to be LGBTQ. So maybe we talk a little bit about that for our audience to establish a baseline for our audience on what we're really talking about in terms of rights and liberties here.
Right, most definitely. I see policies and practices, and we see policies really affect all areas of our life. Policy can be dry if we were to read it, but it has a very real impact in how we live and go about. And when we look at a federal level, there are no explicit protections for LGBTQ individuals when it comes to employment, when it comes to housing, when it comes to public accommodations. This includes long-term care communities. And there have been instances across the US where long-term care providers within their legal right have stated that we will not accept you, based on your gender identity. And so when we see that there's these lack of there's a state protections, there's a lot of work that's being done on the ground to change that, to push for that. However, it is a tall hill to climb. Prior to this work, I worked in Missouri's LGBTQ civil rights organization, and they have been working on passing an inclusive non-discrimination policy that includes not just sexual orientation, but gender identity. This will be the 22nd year that they're introducing it. And when it comes to why, often it is around trans folks that people will utilize and use us as a political pawn of sorts. And so how can we fight that? We can fight that through law. We can ensure that those practices and policies are in place, and not just on a federal and a state and a municipality, where I have the privilege of working within the organizational level, in terms of, are these policies not just inclusive, but are we having practices that train on that? Are there policies that are specifically ensuring that people can use the restroom that they wish to use? And so with the LEI, we have an opportunity to support people to, what does that process look like? What do these policies look like in the field? So that other organizations can learn from that, because right now it is a very real fear of being turned away, and it is a real possibility and very much happening to the folks. And as Jude was speaking, how regardless of how inclusive we create a space, there are some people that will never feel comfortable, but we can still try our best. And it really is supporting folks throughout the age spectrum, and in turn, recognizing that, these policies can have an effect across all ages and for time to come.
Yeah, very good. Leanne, I'm going to call on you. We've got some chatter in the chat box around the issue of dementia, and I missed the question, but I'm hoping you have it there.
Yeah. So the initial question was, do you have any advice for working with trans people who have dementia, who maybe have long-term memory only intact, and maybe they didn't transition until later in life, and they may be demonstrating some confusion about their current identity and body image. Any advice there?
I'll speak to that. This is a question that we get quite often, and I've gotten with working with aging services throughout the past 8 years. I have never come across this in the field, but this is a very real concern that I've heard from various providers. That being said, we are all called to provide dignity and respectful care. As providers, we are called to meet people where they're at, respect them for who they are. So we're just going to meet them where they're at and respect them for who they are. What name would they like to use? That's what we're going to use. Especially if we're talking about dementia and this idea of, best practices, we're not going to say, no, that's not who you are. We're not going to, direct, but rather be in that present moment with that person. And regardless of, for me personally, regardless of my gender expression and transitioning, I've always been Dan. I'm just a lot happier and healthier now. And, I want to feel supported that way. And yes, if I were to, have dementia and, think that I am still my former person, I would still just want to be met for where I'm at. And that's just where we're going to go from in that moment. And it's providing the same care that we would for anyone else. It just looks a little different in context.
Jude, any comments about that? Any thoughts?
That, as Dan said, that's one of the biggest fears that people share with me, that somehow they'll forget who they are or whatever. And I too have never been in a situation where someone has actually done that. It doesn't mean it can't happen, and perhaps the person asking the question has had that experience. But and I agree with Dan's approach, of course, that we have to be, in any event, no matter who we're working with, who has the dementia, to be in that place with them for the time being. I'm personally dealing with this in my family, long distance. My brother just had one leg amputated and has been in and out of hospitals and nursing homes for the last 6 months, and finally got to go home on Saturday. His wife has late stage dementia. So now their daughter is, the caregiver for both. And because of my background, the family turns to me for answers to some of their questions. I will say that typically, as Dan said, most of us, not all of us, but most of our identities were there early on, despite what our outward appearance and presentation might have been. And most of us are we're not confused about who we are to begin with. We're pretty sure who we are. And even the people who identify as gender nonconforming, they're not confused about being gender nonconforming. That's who they are as well. So I think those fears, for the most part, are something we likely will never have to deal with. And if we do, I would take Dan's stance on that.
Very good, very good. Well, we have time for one final question for our panelists. What's your favorite resource you'd recommend to anyone attending today's session? It could be a book, could be a film, could be a poem. What would you leave as a favorite resource for folks?
The Bible, Trans Bodies, Trans Selves. That's the Trans Bible, I call it. So read Trans Bodies, Trans Selves. You can read a lot about it. And if you like to watch TV, watch Pose. You can learn a lot about trans people there. Yeah, that's it.
Jude, how about you?
Well, I have to plug my books. Those are not references, and those are not really resources, although they do contain lists of resources and references within each one. But it's genuine stories from the heart. It's not an academic book. It's people telling just what we're asking the questions today. If you were interviewing each one of them, and I asked them specifically to speak about their, aging, what's happening while they're aging, their fears, their concerns, what they think about an afterlife. Not everyone answered those questions, but I think there's such a variety. There are 22 people in each book, at least 22, who are writing short descriptions, anywhere from 3 pages to 30 pages of what's going on. For my own resources, I am not shy. I am an education nut. I mean, I take seminars, conferences, you name it, whatever. The internet is the biggest resource in the world to me. And just be creative about the search engines that you use and be persistent.
Very good. And Dan, finally to you. Oh, Dan, you're on.
I'm putting one resource in the chat. But the one that I really want to share is a series, an exhibit and book called To Survive on the Shore. It is a series of photographs and interviews with trans and gender nonconforming older adults. It is beautiful photos and people's stories. It was created by Jess T. Dugan, who's a non-binary photographer, and Dr. Vanessa Fabre, who is a gerontological social worker. So it really is a gorgeous, wonderful thing. Thank you for putting it in the chat. talking about people's stories, very real stories, and hearing about our experiences. I know as a younger trans person, I never saw myself grow older because there weren't any possibility models. And it's really beautiful that as we see people be able to be out to share their stories, that we're really making impact across generations. And I want to thank you all for inviting me, and so awesome to present with Jude and Cecilia.
Indeed, indeed. So I too want to thank you, Cecilia, Jude, and Dan, for joining us today. Thank you for everyone who has tuned in to watch this session. Just a little bit of homework here. We've got on-demand content in Slate. And I invite everyone to come back for day 3 of our Generations Forum, which is tomorrow. It's on changes organizations can make to be more inclusive from an employers and your colleagues. So again, thank you everyone for tuning in today. Thank you, Jude, Cecilia, and Dan very much for your participation and for your courage and for your work. You all make us a better place and a better people. So thank you everyone, and have a great day.